Hi, I'm Susan Taylor with Scripps Health in San Diego, California. More and more women are waiting until their mid to late 30s to get pregnant. Advanced maternal age pregnancy, as it's called, pregnancy when you are 35 or older, comes with some higher risks. Here to talk about them are Dr. Daniela Gomez. She's an obstetrician and gynecologist with Scripps Clinic. She specializes in maternal and fetal medicine. Also joining us is Alex Fite. She is a genetic counselor with Scripps Clinic. Thank you both for joining us.
Our pleasure.
What are the odds of getting pregnant after the age of 35?
That's an excellent question, and one that I'm sure many of our patients are wondering. And the answer, unfortunately, is not so simple. However, for someone that is below the age of 35, every month, the odds are actually 20 to 30% of getting pregnant. And that gradually can decrease after advanced maternal age. And then above 40, the odds are actually about 5% with each cycle.
Wow. And so why is it harder to get pregnant after the age of 35?
There are various factors. Some of them include the fact that as we age, we do have more maternal conditions such as diabetes and high blood pressure. However, also it has a lot to do with the quality of a woman's eggs as we age.
So what happens to the quality of our eggs as we get older?
It actually turns out that when we are in our mother's uterus ourselves, we have all the eggs that we're ever going to have. Therefore, we progressively lose them as we get older, and there's some damage that can happen to the cells themselves, which then can lead to the issues we have with that decreasing quality.
And other reasons for the fertility decreasing as you get older?
As we get older, our body mass index, which is our weight compared to our height, does tend to increase. Women tend to get less healthy and less active, and all of those factors can actually affect your fertility.
And Alex, what about chromosomes? Explain what they are and how that factors into fertility issues.
Yeah, so one factor of egg quality that's important is the chance of the chromosomes in the egg being normal or abnormal. So a chromosome abnormality is any condition where there's either too many chromosomes or not enough. So the chromosomes are the structures inside of our cells that contain all the DNA. And typically humans have 46 chromosomes in every cell. Normally there's 2 of each number and either 2 X's or an X and a Y. So a chromosome abnormality would be if there is an extra chromosome or a missing one, or if there is a piece of a chromosome missing called a deletion or a duplication.
And as women get older, what is the risk? Is it called aneuploidy? What is that?
So aneuploidy is the medical term for there being any number of chromosomes in a cell other than the typical 46. So a whole extra chromosome or a whole missing one. And this is the type of condition that's more likely to occur as a woman's eggs get older.
And if you have a chromosome abnormality, is there a genetic component? Let's say, you know, your mom had it or your aunt had it. Is it more likely that you will have it as you get older?
So in some cases, chromosome abnormalities can be passed down in the family, but in the vast majority of cases, it's something that happens randomly when the egg is forming or when the sperm is forming. But egg cells are more prone to these types of changes for the reason that Dr. Gomez mentioned, that because women are born with all of our eggs, they become more prone to these changes over time.
So Dr. Gomez, if somebody's having problems getting pregnant and they come to you, what do you recommend?
If a woman is having trouble getting pregnant, the first thing would be to assess whether she is ovulating or not, which means whether or not there is an egg that is actually being released every month to allow for it to be fertilized by sperm. By asking a woman simple questions about how often she gets her period, as well as if she's having any symptoms with it, I can determine whether or not she's likely to be having what we call an ovulatory cycle, meaning that there is an egg being released. I also want to ask questions about the timing of intercourse, because obviously if you are not having intercourse at the same time that the egg is present, fertilization will not happen, and so the couple will not get pregnant. If all of that seems to be in order, then I can move on to other causes. There can be hormonal reasons, and there's laboratory tests that we can do to check for that. There can be what we call structural reasons for the inability to get pregnant, and that would include problems with the woman's uterus, which is the womb where the baby will be living. If there's an issue with the cervix or the fallopian tubes or the ovaries themselves, there's imaging that we can do to help with that. It could also be the partner. The partner's sperm sometimes the counts are low, or sometimes the sperm itself has issues with what we call morphology, which is just a fancy name for the shape, which all of that can affect the fertility of the couple. So there are some basic tests and some ultrasounds that I can do initially, and just some basic history. If I determine that there might be a bigger issue, then I would refer them to our reproductive endocrinology and infertility colleagues, since they are the true experts when it comes to infertility.
And what about other risks of getting pregnant after the age of 35?
After the age of 35, as we've been talking about, there is an increased risk of aneuploidy or chromosomal abnormalities. But in addition to that, you do also have health risks for the mom. Just at the very beginning, sometimes the pregnancy does not form inside the uterus, it forms outside the uterus, and that can be quite dangerous. It is referred to as an ectopic pregnancy, and unfortunately, the risk of that does increase with age. You can also have an increased risk of miscarriage, and that risk does go up again on a continuum. So starting at the age of 35, it does start to increase, but it is way higher after 40. You can also have risks throughout the pregnancy: increased risk of diabetes, increased risk of something called preeclampsia, which means your blood pressure is elevated during the pregnancy, also comes with some other abnormalities and risk factors. You can also have an increased risk of a cesarean section because labor curves just don't, they just don't do the same thing in some of our patients that are older.
So if you are 35 or older, what should you do to prepare for a healthy pregnancy?
That's an excellent question. There are very many things that can be done. One of them is, if you are overweight, losing even 10% of your current weight can actually decrease the risks for your pregnancy significantly. If you have a medical condition, seeking a preconception consultation with maternal fetal medicine and with your primary care doctor will help you get that condition under control to the best of our abilities, so that we can decrease those risks for you. You want to make sure that all your vaccines are up to date, so that you have all the antibodies that you need to keep you safe during pregnancy and potentially keep your fetus safe as well.
And Alex, what other tests should you have before you get pregnant if you're over the age of 35?
Yeah, so for genetic testing, because chromosome abnormalities in the egg are forming right up until the point of conception, there's not a way to test your egg's chromosomes before you conceive spontaneously. But there is another type of testing called carrier screening that can be done for any couple that is planning for pregnancy before they attempt conception. And this is basically a blood or saliva test for both genetic parents that can determine if someone is a silent carrier for a condition that may be passed down in the family.
And once the woman is pregnant, what kind of tests are there to detect chromosome abnormalities?
So starting at about 10 weeks of pregnancy, there's a screening blood test available called cell-free fetal DNA, also called non-invasive prenatal testing, or NIPT. And this is a blood test that can analyze DNA from the placenta and quantify the amount of chromosomal material for certain chromosomes. It looks at chromosome number 21, which tests for Down syndrome, also chromosome 18 and 13, which tests for trisomy 18 and trisomy 13, which are more rare but very severe disorders.
And what about amniocentesis? What is that?
Amniocentesis is a test that's done once someone becomes pregnant, and it's a form of diagnostic testing. It's a procedure where a physician, a perinatologist generally, will use a needle that they insert into the pregnant woman's abdomen and withdraw a little bit of amniotic fluid. That amniotic fluid is then sent to the laboratory, and there are several different tests that can be done on that fluid, different genetic tests for whatever particular condition we are trying to diagnose.
And talk about the Scripps perinatology program. What is that?
The Scripps perinatology program encompasses a large team of professionals and specialists that are there to help women that have pregnancies that are considered high risk. Myself and my colleagues, we will provide consultations, and we will also manage your pregnancy very closely with your obstetrician throughout to make sure that nothing is overlooked. We have genetic counselors such as Alex, who will also provide a lot of information that is helpful to you to help decide what is right for you in your pregnancy. Our nurses are excellent and make themselves available to our patients to help answer their questions and guide them through their care. Our entire team is very empathetic, since we do know that sometimes there are very sensitive conditions that we are dealing with.
And Alex, go into a little bit more depth about the genetic counseling that's available in the Scripps perinatology program.
Yeah, so our genetic counselors are available to meet with anyone that has a risk factor for a genetic condition in their current or their future pregnancy. So if they have a family history of a genetic condition, a birth defect, intellectual disability, if they have some type of abnormal genetic testing results that have been done either prior to or during the pregnancy, or if there's any ultrasound findings, your doctor will refer you to a genetic counselor to discuss the significance of these findings, discuss what the risk information is, and what the options are for testing, as well as interpreting and communicating results to you and kind of walking you through the process and helping you kind of understand and process all of this information.
Because it's a lot to process.
It can be a lot.
Any final thoughts?
My biggest thing that I want everyone out there to know is that having a pregnancy after 35, yes, it does come with some additional risks, but they're all risks that if you see us early on, we can help manage and we can get you through your pregnancy, both you and your baby, very safely. So don't be discouraged. Having a pregnancy later is actually becoming a lot more common, and we're here to help.
Any final thoughts, Alex?
Yeah, I'd love to echo that sentiment. Also talking about the risk of chromosome abnormalities. Even though the risk does increase gradually as women age, it's still overall much more likely for any pregnancy to be chromosomally normal, regardless of what your age is. One example I think it's helpful to point out, for a woman who's 35, the risk is about 1% if you're testing at 12 weeks for there to be a chromosome abnormality. So overall, the chances are still quite good that everything will be healthy.
Dr. Gomez, Alex, thank you so much for being with us. We appreciate you both taking the time.
Thank
you so much.
If you want more information about having a baby, if you're age 35 or older, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.